started. So good afternoon, everyone, and a warm welcome to our Policy Modeling for Health webinar. I'm Nora So, a Senior Program Manager based within Public Health at the University of Glasgow, and I'm also the Program Manager for Policy Modeling for Health. Policy Modeling for Health is one of 4 consortia funded by UK Research and Innovation as part of its £35 million Population Health Improvement Network, which supports innovative research aimed at tackling the wider determinants of health and reducing inequalities. Our work is focused on developing advanced computational models to help policymakers explore the likely effects of different policy choices on health outcomes and their distribution in society. This is the first of a series of webinars specially curated for our partner organizations. Each will focus on a different aspect of our consortium activities, and all will be pitched at an accessible introductory level. In addition to these specials, we are also planning a public webinar series of short lunchtime talks showcasing our latest developments with the chance to ask questions. Recordings of all webinars will be available on the Policy Modeling for Health website. So now I'm delighted to introduce our speaker for today, Dr. Corinna Elsenbroich. Corinna is a reader of computational modeling and principal lead of Strike project based at the University of Glasgow. As part of the Policy Modeling for Health Executive Group, Corinna is at the heart of our consortium, championing our training and capacity building work and leading our model literacy work package. In today's webinar, she will explore how microsimulation can be applied in policy settings with a focus on how to interpret and use its outputs effectively. Please feel free to submit questions anytime via the Q&A tab, and we'll come to these at the end of the presentation. Corinna, over to you.
Thank you, Nora. Thank you very much. It's really weird that even after 5.5 years of speaking into the void of online presentations, I still can't get used to it, especially if I can't see any faces. So I find this a little bit weird. So bear with me if I spiral talking to myself and my screen. So today I'm going to talk about microsimulation modeling. And I really hope I'm not going to teach grandma to suck eggs here, but what I tried to do was to go into a step-by-step what happens in a microsimulation actually, and what does it do? Because I tend to think that once I understand how something works, it's much easier to apply it and to apply it in a proper way. So without much further ado, let's just dive in. So what is the problem? The problem is essentially that we need to make policy decisions, and they involve spending money, and we need to be quite sure that what we spend our money on is actually something effective that has the right kinds of consequences for society. So what we want to do is, thinking about our policy options, we want to understand what the potential consequences of each option might be. Now, microsimulations are models that simulate a population forward so that you can actually test out what consequences particular interventions might have. But microsimulations don't do it at this sort of aggregate level projection of the whole society, where you have something like, oh, we're expecting wealth inequality to reduce by 5%. Microsimulations go down. They model the specific individuals in a society, and then they forward the consequences of the policy for these individuals, and then they aggregate up again. And what they can then say is that because people on low incomes are now able to save money, we expect wealth inequality to reduce by 5%. Okay, so the microsimulation, really importantly, has 2 levels. And we get to that in more detail. Now, what they're particularly good at is modeling heterogeneity across populations. So because they are looking at the individuals to whom it will make change, our policy intervention, they can look at, well, these people are not affected, but there is a subpopulation that will actually get quite a lot of benefit out of a particular intervention. Now, microsimulations have sort of, the microsimulations that we're using in policy modeling for health are composed of sort of 3 different components, synthetic population, the UK mod, static microsimulation, and SimPaths. And what they are is a synthetic population is essentially a truthful representation of a real population over a set of variables. So, you know, we all know the census, and each person in the census has all the questions that they have been asked in the census as their little variable table with values. So, you know, age 50, female, etc., etc., etc. A synthetic population is a replica of that, plus a few things that we might want to enhance the census information that we have. The census is fairly basic, has sort of residence and employment. No, it doesn't even have employment, age, sex, blah blah blah. So in order to get a slightly richer population, the synthetic population for policy modeling for health integrates also understanding society, so that we have knowledge about people's employment, people's house ownership, and stuff like that. So synthetic population really is a representation of a real population over a set of particular variables, okay? And this population are the little individuals that we are then modeling in our microsimulation. And the synthetic population is something that we need as a basis for a microsimulation. Now, the second component within policy modeling for health is UK mod, and that is a static microsimulation model that that represents the tax and benefit system of the UK. What that means is that it tells us who will pay what kinds of taxes and could receive what kinds of benefits in certain situations. And UK mod is actually best explained by a use case. And after each budget, the sort of Guardian publishes this wonderful, you know, who are winners and losers of the budget changes, that a family with 5 dogs and 3 children will now have to pay more tax and get less benefits, for example. And that's the kind of thing that UK mod does. UK mod is really focused on income tax benefit, this sort of the nexus of income tax and benefits, and can be then applied to the population to then do a sort of morning after scenario of changes to the tax and benefit system, saying, oh, these are the winners and losers. Now, the third component of policy modeling for health is called SimPaths, and that is a dynamic microsimulation. So UKMod was a static microsimulation that gives us a morning after scenario through changes of the tax benefit system. SimPaths is a dynamic microsimulation that allows us to model further in the future, year by year by year by year. And what it does, it provides a sort of rich specification of how aspects of a person's life interconnect. And we can see that here. So we have questions about education levels, physical and mental health, partnership, social care, their income, wages, tax benefits, consumption, wealth, and mental health. Okay, so SimPaths is actually taking our synthetic population and can model it through year on year on year. And what that is particularly good at is, for example, allowing us to model cumulative dynamics. If you think of, for example, of wealth, UKMod can give us the morning after scenario, but wealth is something that you accumulate over time. So for these kinds of aspects of a person's life, like accumulating wealth, you need something that is much more long-term, and SimPaths is the possibility for this longer-term microsimulation, the dynamic part of the microsimulation. Now, with a microsimulation, you can do loads of fantastic forecasting. So here, for example, you can forecast demographic trends. Here we can see that retirement rates, well, people who are in retirement will increase dramatically between 2024 and 2040. This is a SimPaths forecast. And this is essentially calculated through fertility and mortality data, where we have an aging society. And if our retirement age stays the same, we will just shift more and more people into retirement as part of the population. We can look at economic inactivity within SimPaths because we have the employment status of people, and you might be quite shocked here and think, oh my God, everybody's stopping working between 2024 and 2040. That is not the case, luckily. Partly this, the employment rate that reduction that we see here has to do with the retirement. So retired people are no longer in employment. So if we have these increases in retirement, then we have an automatic decrease in employment. But SimPaths can also model additional changes to the employment rate, additional to just the demographic change of a society. It's fantastic at modeling the education distribution of the population. And here we can see that we're getting, over time, we're getting to a overall higher educated distribution of the population. And that is, for example, through changes to the compulsory school age. So we have less people with no qualifications leaving school because of the changes at compulsory school age, and the expansion of higher education means more people will have degrees, and so we're having a higher level of education overall in the country. So SimPaths can do all these fantastic projections: demography, employment, education. These are just examples. And SimPaths is great because it's really, really well validated. Okay, so it's the projections, the historical projections that it does over a data set of the last 40 years are very, very close to the real data, which gives us a lot of trust in the forecasts also being sensible. So these are the three aspects that policy modeling for health has and develops further: the synthetic population, UK mod, which is part of SimPaths, and SimPaths, which is the dynamic microsimulation that really takes individuals through their life course of with all the important aspects of education, having children, employment, unemployment, retirement, etc. But how does a microsimulation actually do this, right? We can see, we all know, fantastic projection methods and data analysis methods. And I just want to really hone in on how does a microsimulation actually work? What are the step-by-step developments for a microsimulation? So bear with me. If you are a microsimulationist in your audience, you might start yawning now. But this is the point where I think knowing exactly what is happening might be useful for understanding how you can better use it in policy. So what we're interested in is the effect of a particular policy on a population so that we can measure the difference between the population at time 1 and then the population at time 2 after the intervention, and to see what are the changes and are the changes worthwhile. Was the policy intervention a really good idea? So let's look at, for example, increasing the minimum wage. Okay. So we might just say, oh, well, if we increase the minimum wage, then our wage distribution will change because nobody will be below the new level of minimum wage. Let's call it £12.60. Well, yeah, that is something we can say at the population level, but it's probably not particularly useful. So what the microsimulation does, it is going away from the aggregate level projection of, the wage distribution. And it's saying, okay, let's take a synthetic population, let's take a representation of all the individuals in our society, in our population, and then say, okay, we're increasing the minimum wage. So first of all, we have to look at who will actually benefit from that. Well, it's people who are currently on the minimum wage and who will get a little bit more money, right? So in our synthetic population, we can single out those people who will get an increase in minimum wage and then increase their wage and then forward them. And then we can go aggregate up again and see, oh, okay, the wage distribution has changed in the following way. And the wage distribution overall will change in different ways because, we might have a very, very large subgroup of people on the minimum wage in a population or not. Okay, now the microsimulation can also immediately model other things. So the individual has an increase in their wages, but that means they have an increase in their disposable income, right? That might mean if their outgoings aren't higher than their income, they might have savings and they might have wealth that they can accumulate. So the change in the minimum wage will have an effect immediately on some people, and then over time will have further cumulative effects on these individuals. And that's why we need the dynamic microsimulation. Okay, so SimPaths, as I said, takes people through different aspects of their lives and connects different aspects of people's lives together. So, for example, staying with the example of increasing the minimum wage, here we have the wage rate that has an effect on employment, and we get to an example later. And it's saying, oh yeah, okay, we also have to have then more potentially pay more taxes as the wage rate goes up. But this is sort of the dependency model on which SimPaths relies, and where SimPaths says, okay, there are aspects of the wage that will have to do with decisions of an individual on employment and has effects on their disposable income, which then has effects on maybe their consumption and on their mental health, etc. So SimPaths is really quite rich in how it models individuals, guiding them through some major life course transitions, education, leaving parental home, etc. And what SimPaths gives us between once it applies a change to the synthetic population, to all the individuals in the synthetic population, is basically, if you think about it, it is basically giving us what we might expect to find in a future collection of understanding society. So if you think of these aggregate level things, this is one iteration of understanding society. And SimPaths gives us what we expect in the future in terms of employment, wage, etc. So how does that do that? So again, let's dig deeper. So SimPath starts with the synthetic population of individuals. So here we have Steve. Steve is 18 years old. He's doing his A-levels. He lives in the northeast of England. He's male. His education level is medium because GCSE and A-level are called are a medium level of education. Still lives with his parents. He has quite good physical health, slightly wobbly on the mental health, 14 out of 36. I mean, he's all right, but he sometimes has a bit iffy episodes. He's a teenager, so it's not too bad. He has no income at the moment, as he's 18 and living with his parents. Now at time 2, Steve is now 19. He has done his A-levels, but his education level is still medium. He's still living with his parents, but he has started work, so he's now employed. Okay, he now has a wage. He has a number of hours that he's working. He has some disposable income, and and his outgoings are very low because he lives at home and he doesn't pay any rent. Okay, so this is a transition of an individual between 2 time points within SimPaths. Now, a year later, Steve has saved up some money and decides that he's going to move out of his parents' house. So now he's in a single household. He's still working his 40 hours on £13 an hour. And his mental health has taken a toll because he's a bit overworked and he's feeling a bit lonely. But luckily in time 4, he has been with Jamie for a while, but Jamie and Steve now decide that they're moving together. Okay, so now Steve has changed his status to partnered. They have moved into the same house. They're still living in the northeast. Steve is now 21, and he has decided that he's going back to full-time study. So he's becoming a student. He's still working part-time to earn some money, but he doesn't need to work for the whole lot because Jamie luckily owns the house, and he can just get enough income to have some disposable income. So essentially, microsimulations are telling these stories of individuals and how they change, how they move from year to year to year through particular life course events, right? Like partnering up and moving together and going back to education or not. But how does the microsimulation know what changes will happen to Steve, right? And this is where we're getting to the biggest crux of microsimulation. So in the synthetic population, we have these individuals that are essentially just these data tables. They're a set of variables and a set of values. Now, in order to understand how these transitions work, why, Steve actually went back to becoming a student, we need the microsimulation, and what we need in the microsimulation is what is called transition probabilities. And these transition probabilities are probabilities for an agent to change their state in the next time point. That could be the probability of the agent to die, the probability to stay in education or rejoin education, the probability of becoming unemployed. And different people have different probabilities of these things happening to them, depending on other aspects of their life. So, for example, for the probability of Steve actually turning 21, we take a mortality table. And we're looking at, okay, mortality tables are done here by gender and by age. Sorry, by gender and by age and by year. And then we just look at the year 2024, and his age is 20 and he's male. And we look at what is the probability of an agent, a male agent or male individual at age 20 to die is very, very, very low. So there's a very high probability that he'll transition to be 21. Note, probabilities are a bit scary, right? Even though there's a low probability of Steve not making it to 21, there is a probability. So some 20-year-olds will drop out of the simulation. It's just very few. Okay, so this is quite a simple probability, simply taken from a mortality table on gender and age. Other probability transitions or transition probabilities are much more complex. For example, the probability for an agent to remain or rejoin education is calculated from their age, their sex, their region of residence, their previous education level, and importantly, the education level of their parents. So now we're having other agents in our synthetic population linked to, for example, Steve. So here we have John, his dad, with a medium level of education, and Jennifer, his mum, with a high level of education. And all of these are condensed together into a transition probability for Steve to become a student again. Again, Steve might have a very, very high probability, given that his mother has a very high level of education, and he might never rejoin education, but there is a high probability of it, okay? So these transitions are determined by probability functions that are added to the variables, the values, and then probabilities for these values to change at a future state. So really, a microsimulation is not just the aggregate level of society, of a population, and the micro level of the individuals that is encapsulated in the synthetic population, but it also has this subgroup level. And it's the subgroup level where the transition probabilities come from, okay? What I mean by subgroup level is they're essentially similarity relationships. We're taking associations, statistical associations from people who are similar to the individual that we're looking at on how they transitioned in the past, how likely it was for them to go back to education or stay in education, how likely it was for them to die, right? So there is this subgroup level where we're saying, okay, Steve is similar to other male 20-year-olds, and thus he has a very, very low likelihood of not making it to age 21. Now, this is a really important point, that these subgroup similarity relationships are our decision what makes sense, what are good predictors or good coefficients for the transition probabilities. So for example, here the mortality tables of age and gender are really very good. But you might ask, but really, shouldn't the health status be in there? Because somebody with a very, very low health status is more likely to die. So maybe there is a point in actually, changing this for a different purpose simulation. Okay, so now we have a microsimulation really consisting not just of the aggregate part and the synthetic population part, but also this middle part, the subgroups, where the transition probabilities or the statistical coefficients come from that determine the change. And microsimulations are really this constant dance between getting the micro specification right in the synthetic population, getting the transition probabilities right in terms of the similarity relationships and the coefficients that are producing the change, and then the aggregate level of the population, where we have the validation moment of saying, yeah, what we're getting out of our microsimulation looks pretty much like what we're getting in historical data. Okay, and these three layers are really also where we have to focus on when we're building microsimulations. So the first thing is, did we get the synthetic population right? Is this really a good representation of the population of interest that we are trying to understand policy interventions about? And that is something where policy modeling for health has made absolutely fantastic progress. We have a really good synthetic population that works at the individual and at the household level and at small geographies. Now, the second point is that we need to get these transition probabilities and dependencies right. And that is very much where SimPaths comes in, right? SimPaths is really well validated in getting the transition probabilities for the variables that they are incorporating, and that's all the variables you've seen in my example of Steve, are getting them right because they can recreate historical data across a range of aspects really well. And at the top, at the aggregate level, we also have to get something right. Because as in all statistical research, we have to assume that the future is sufficiently like the past to actually do this transition. Because we're saying we're doing an intervention on the minimum wage, but we're assuming that everything else stays the same. Okay, that people keep the same relationship between their health, their employment, and their income, for example, that they make the same considerations. And most of the time, this assumption is probably okay, but we might want to check because there were stories that after COVID, people really started to value work and health in different ways, and they were making different decisions. So it's worth checking whether our assumption that the future will be exactly like the past, that all the relationships will remain the same, is actually given. Okay. So these three levels should also help us to think about where we can run scenarios and where we can induce change within the model. Okay. So one thing is we can change attributes for the individuals. That is, for example, changing their income, changing their wage, changing their outgoings, their consumption. Okay. So that is one level where we can intervene, or where we can model an intervention through a microsimulation, through a change in income, or whatever other variable you're choosing for the individual that is there, that is given. Now, the second change could be that transition probabilities change. For example, that income is starting to relate differently to health status because there have been massive changes to the NHS or to health prevention or through whatever that might make a big change, or through people, just doing different things with their money. So the second layer where we can model an intervention is by changing the transition probabilities. And the third layer is really where we're saying, okay, something massive has happened. We have to start modeling a shift in people's understanding of what employment and health, the relationship between their choices about employment and health are, and that would be at the causal level of the causal connections that are modeled within SimPaths. Okay, so now we have what we have in policy modeling for health are synthetic populations, UK mod and SimPaths. Synthetic population is just a static representation of a population. UK mod gives us a morning after scenario exploration tool for tax and benefits changes. And SimPaths gives us a dynamic microsimulation of changes across a range of attributes or variables. All three of them together constitute these three levels of the individuals where we can make interventions, the transition probabilities, which are really incorporated in SimPaths, and the causal structures that we're assuming are constant between time 1 and time 2. So now you might be glad to hear I'm coming to the last bit of the presentation. And this is about running scenarios, and this is all based on work by our fantastic embedded researchers. So thank you very much for sending this through. And I'm just going to very briefly walk you through one scenario in a little bit more detail, sketch out how they relate to other scenarios, and then sum up. So what does it mean to run a scenario in a microsimulation? So let's take an intervention that is a research question that is, what are the health and economic impacts of raising wages for all workers across the UK to the real living wage? That does not mean that everybody gets the living wage. That means that everybody at the bottom is raised up to get the living wage, right? So people are not reduced to a living wage. It's raising the floor to the living wage. Now here we have an individual. And I would like just to reiterate that these are all the variables that are currently state variables in SimPaths. Okay, so we have a bit on health, we have the household status, we have quite a lot of stuff on their economic aspects and their consumption levels. Now, having this research question, what are the health and economic impacts of raising wages for workers to the living wage? The microsimulation, first of all, allows us to identify the individuals that are below the real living wage at the moment, and we can increase their wages. So here we have an increase from £10 hourly wage to £12.60. That means they have immediate change to their disposable income. It's now 25,000. I made these numbers roughly. They're very rough numbers, okay? But there's an increase of disposable income from 21,000 to 25,000 through the increase to the living wage. So that's something we know immediately, okay? We can immediately calculate what the new tax intake will be for the Treasury through UK mod as well. Now, at the next time step, at time t plus n plus 1, we also expect that, for example, to have an effect on an individual's mental health, because now, their consumption has stayed static at 21,000 and they have a little bit of money that they can save. So it'll make some changes in 1 year later to their savings rate, but it will also make probably some changes to their mental health. At least this is how it's modeled in SimPaths, right? There is a there is a connection between a wage rise, disposable income rise, and mental health. It could also have an effect on their hours worked. They might decide, oh, if I earn a bit more, I can actually work a few hours less. I'm fine with having the same consumption level, but it frees up some time for hanging out with my child or something like that, going to the gym more. Health models, SimPaths also has something else. It has that individuals might rejoin the labor market because of an increase in pay. So a new individual might say, oh, it's actually worth it for me to now join the labor market, and there is an increase in employment. So what do we get here? We're getting the microsimulation intervention will just change the wage of a data record in our synthetic population. We will then get some direct UK mod changes to their income, their tax, etc., and to the population level income distribution that we can take immediately after raising the wages. Okay. Then longer term, we also have changes to maybe to the employment rates or to the mental health distribution, where we're looking back at the aggregate level. So thinking about this policy scenario, we do the intervention at the individual level for those individuals that are below the minimum wage or below the living wage, that are earning less than the living wage, and they're upgraded. So they have a change to their wage and their disposable income. Then we apply transition probabilities to actually move them forward year on year. And the main modules within SimPaths that are needed are the labor market module and the mental health module. That's what I gave you in the example, right? Of the person's mental health improving and somebody maybe rejoining the labor market because it's now worth it compared to the benefits. And what we can measure at the population level to see whether our intervention actually worked is questions about how much tax the Treasury will take in. We can look at changes to the income distribution, changes to the employment rate, or the mental health distribution. Okay, so yeah, I just hope that I made clear how the intervention would actually go through a microsimulation model and where the intervention sits and where the measurement afterwards sit for the consequences. And here are some other test scenarios that our embedded researchers have been doing in the organization. So we had the uplifting of the minimum wage, the Scottish income tax, and improving educational attainment. Now, for example, in uplifting the minimum wage, we had an increase to the hourly wage for a subpopulation, and we could afterwards measure the wage as well as the income distribution, okay, because both of them will change because we've changed the wages. For the Scottish income tax, most of the stuff will be the same because there will be a change to disposable income, but we're not changing wages. So at the population distribution level, we will not have a change to the wage distribution to be expected, only to the income distribution, okay? So these are still very much changes just of wages and taxes, etc. Very much changes to disposable income of a household. Improving education is a completely different kettle of fish of the microsimulation. Education is within SimPaths within this dependency structure of which bits of a life course interconnect with others. It's much more important in a way where uplifting education levels, some people from low to medium and some people from medium to high, will have effects on the education, of course, but education is interconnected with employment, with income, with mental health and physical health. And then we can start looking at distributions of employment rates, but also mental and physical health distributions, okay? Where the changes to the tax and benefit system might be more marginal than in the other two examples. Okay, so I hope these different levels might make it easier to think about policy scenarios and how they translate into microsimulation framework and what the kinds of things are that you might be getting out of them. And here again, this is work by our embedded researchers. They made a really nice list of different kinds of scenarios that you can try out within the microsimulation. You can essentially make changes to the tax and benefit system. So this is very much UK mod, and that will change individual income and mainly disposable income variables for a subpopulation where it attaches to. You can change the synthetic population itself, and that would be changes in the subpopulation that are independent of the disposable income, like education levels or increasing the level of health, etc. And then you can make modifications to the SimPaths model, where you're saying, well, maybe we have to reconsider the dependency structure, the causal structure that SimPaths is actually looking at. We might have to make changes to the transition probabilities. That becomes really, really very difficult, okay? And I cannot stress enough, and I hope I got this across, a microsimulation model is not a replica of the world, right? It's not a little replica that we have somewhere and where we can then just dabble around making all the kinds of changes that we want. A microsimulation model is a representation of a population over a particular set of variables with their values, and we are changing those values as a consequence of a particular intervention. Now, very importantly are the timelines as well. The model goes from 1 year to the next. So, for example, if Steve had a 6 months unemployment stint in the year, we wouldn't capture that in understanding society either. Okay, so our microsimulation just takes a data record and forwards this changed data record, changed through the intervention, into the next time point. Outside of that, the agents have no change. I hope that makes sense, right? Yeah, so it's not a replica, it's a representation of what we consider the important features and relationships of the world, and that these features and relationships are the microspecifications, so the set of variables we're choosing, for example, to describe an agent. They are the transition probabilities, and that is the similarity relationships to other subpopulations, and that is the dependency structure of the SimPaths model of what interconnects with what, that employment, tax and income are then also connected to mental health. Okay, so that's my final slide. What is microsimulation good at? It's really good at modeling path dependency and cumulative effects. Path dependency, for example, education can only go up in our modeling. Cumulative effects like wealth accumulation, but also other cumulative effects, as we've seen with education, where a more educated population will bring about a more educated population, because higher education levels of the parents will produce higher education levels of the children. It's not a magic replica, it's not a crystal ball, but it's a really, really amazing data manipulation tool that allows us to go into the micro level and look at the changes that a policy will produce at the micro level, and then aggregate up again into the full population level. Now, unfortunately, like everything, there's also quite a lot of limitations. I think the main microsimulation limitation is really it's unbelievably resource intensive. It's very data hungry. It takes a long time to develop and build. It takes a lot of work to maintain, and has relatively high computing resources. So that is really a downside, because it's not like a statistical model that you just throw at another data set. It is the integration of lots of different data sets in a meaningful way. But I still hope I've shown you in this webinar that SimPaths is a very, very rich model that lets us explore a lot of interdependencies through going to the micro level and looking at change and then aggregating back up. So these are Our funders that Nora mentioned to start with, just to acknowledge them again. Thank you for listening. Our next webinar is on the 23rd of October, what makes a good policy simulation model. That should be great fun. And now we have time for questions. Thank you very much.
Thanks,
I'm public
Corinna.
sharing now, don't I? Do I
Oh,
stop sharing?
yeah. Yes, please.
Super.
Thank you for that, Karina. To the audience, if you have not already submitted your questions, please use the Zoom Q&A tab and we will get to as many as time allows. So for the first question, Karina, how do these models handle generating new births? Are they determined by parent pairs in the microsimulation?
Sorry, are they
Are they determined by parent pairs in the microsimulation?
okay? I mean the offspring, you mean, how they are generated?
I think so. So specifically, the question says, how do these models handle generating new births? So yeah, the offsprings.
Yeah, okay. So that is done through a fertility rate and a likelihood. So if people are shacking up together in the microsimulation, they're meeting each other like Jamie and Steve did, and they have offspring, then these are connected in the data records of the microsimulation.
Yeah. The other question was, are we able to explore the individual slash population level on different sectors of the economy? That is, say, to explore, for example, an interaction of policies in the agriculture and changes of living wage in the local area.
Okay, there are 5 questions in that. Can we do things in a local area? Can we combine policies? So I'll start with the local area. Microsimulation can be done at local area level, but it's really important to understand that there are potential drawbacks because, as I said, we have a synthetic population and we can get that into very, very small area validation now, and that is great. But when I explained that we have transition probabilities that come from a much larger population, they will still apply to the individuals in the local area. And we might think that they're actually not the appropriate ones, but it's very difficult to change transition probabilities. So, as a silly example, we might think that if we want to look at people moving away from their parental home, well, in the southeast, the transition probabilities should not just be gender and age dependent, because the property prices are so high that it's even less likely for anyone to leave their parental home. Okay, but that is quite difficult to narrow down transition probabilities and change them to become to come from much more localized populations. So that's on the local. Now, can we model different policy areas? Yes, we can model whatever we want as long as we understand the impact it has on the set of variables that are describing the individuals. So if we think that what was the example? Sorry, I forgot. There was an economic policy.
Agriculture
So
versus living wage.
if we have the living wage, and then I don't know what an example of a good agricultural policy would be. So if let's say we are combining an education policy and a living wage policy, that we can easily model because we have education in our individual description as well as income, right? So as long as we can translate it into a change to the variable for the individual in the synthetic population, we can model it. If it goes outside, it becomes much more difficult. Hope that answered it.
Thanks, Karina. The next question says, you mentioned the resource hungry nature of the method. So, beyond falling into a consortium who are already developing microsimulation models, how best might an organization or team begin the process of becoming microsimulators?
To just to develop a new microsimulation is, as I say, really very, very resource intensive. That's why microsimulations are usually done by very large organizations like national governments, etc. Okay, if you look through the literature, most big microsimulations are really at that level. Just doing a little local microsimulation is also quite tricky. And then there I go back to the problem of the transition probabilities, because if you're just taking your localized data set, the smaller your subpopulations will be, the more volatile your transition probabilities and the less consistent over time they will be. So to just develop a new one is probably not a good idea. The way to do it is really to use something like SimPaths, which has a long history of development and a lot of resources that went in to develop it, and then potentially scale, take that simulation and localize it. And that is something that policy modeling for health is doing through the embedded researchers, through amendments to the synthetic population and making that more localized.
And then the next one is, what are the typical timeframes that policies are modeled across, and what is the drop-off rate of accuracy?
That that really depends on the kinds of policies. So, for example, I think this is something where I would make a big distinction between the UK mod part and the SimPaths part, for example. So if we are, for example, modeling an income tax change or a wage rise, then we're modeling disposable income. We're then saying, okay, consumption will stay roughly the same, maybe with an inflation increase, but nothing more. And then we can model forward with quite a lot of accuracy what is happening, right? And until the cost of living crisis hits, then all bets are off because then the world has changed. Okay, so for something we can also then stipulate wealth accumulation if we think that consumption stays the same, but we know that disposable incomes are going up considerably, we can start making assumptions about wealth accumulation for different populations, and we can do that over a longer time frame. The further away from these very, very close monetary aspects we go, the more haphazard it becomes, of course, right? I think in general, I would say a typical time frame is probably in the 5 to 10 years for the more tenuous aspects. So if we go back to the first maps that I showed you, they were on a 16-year range, but they were also projections over fairly stable aspects of the microsimulation, like demographic development, mortality and fertility rates don't change very much. Education does not change radically. So these projections were quite good over a 16-year period.
Thanks, Karina. So how do you determine how to change transition probabilities for less direct interventions, such as increasing house building rather than changing minimum wage?
Okay, so the transition probabilities that I talked about are transitions of individuals. Okay, so they're not big transitions of having more houses due to the increased house building rate, for example. Yeah. How a massive increase in house building might be modeled in SimPaths is that there is a higher likelihood or a higher transition probability for our individuals to become house owners. And that could be through a drop in house prices, or it could be through needing less wealth, so no down payments or something like that. Okay, but in general, changing transition probabilities in a microsimulation is not an easy task. So it's really important to keep in mind that a microsimulation is a really complex connection between lots of different data sets, or data sets, in the sense that you have all these individuals as a data set, the synthetic population. And then every transition probability for each individual again comes from a data set like the mortality table. Okay. And the microsimulation is the interconnection of all these different pieces of information that we have about the world. So making changes to the transition probabilities is a big ask in a microsimulation.
We'll do two more. Do you, sorry, how do you account for social change in this model?
You don't. And I think this is really, really important to keep in mind. So, and this is what I meant with at the population level, we are assuming things are stable, right? We are assuming that the future is like the past. We're assuming there are no huge changes. There is a macroeconomic change part of SimPaths that I didn't go into. So inflation or something like that can be modeled. But again, on the individuals, I mean, in the end, that is just a bottom line change to their disposable income, isn't it? How it translates through to the individuals. But yes, you're right that it's not a model of modeling big social changes and forces. It is a model, it's a statistical model that is trying to model change under the assumption of relative stability. Okay. And I think that is actually really important to keep in mind with the microsimulation. As with all statistical models, they all rely on a similarity between the past and the future.
Corinna, would the model also be capable of capturing ripple effects? Sorry, something scrolled up. Ripple effects of an initial intervention.
Okay, so sticking with the minimum wage example, we might see the overall wage structure adjusting if the floor is raised. No, I don't think it does at the moment. Again, it is if you want to have something like that, if you want to have cascading effects, ripple effects, then you have to model the interdependencies of loads of different agents' decision making, and that is not part of a microsimulation, right? You could say, as I said, there are some macroeconomic structural aspects that can be modeled, like an inflation rate. You could say by raising everybody up to the living wage as a minimum, I also make the assumption that the economy will adjust and we have the same inequality distribution. So I'm lifting everybody else up a tiny bit, but it would be an exogenous decision imposed on the microsimulation. So it would not be an emergent effect from the microsimulation, if that's what you were asking for.
Thank you, Karina. So we're at time. So very last light-hearted question. Do you actually give the simulated individuals names?
No, Steve, Jamie, Jennifer, and John were just for demonstration purposes.
Thanks, Karina. Thank you all for joining us for today's webinar and for all your questions. A full recording will be available on the Policy Modeling for Health website soon, so please watch out for that and please feel free to share with colleagues who were unable to join today. Thank you again and have a great day.
Thank you very much for coming.